These parallel bars are provided to us by the charities, have a couple of different features on them that make them much more easy to use in terms of treating patients. They're a hydraulic system, so we can actually just press to raise and lower the side of the bars, which can be done there and then with the patient to get to the exact height to make it easy for the patient to mobilise. The other bars are more of a locking system, so you have to reach down and lock the bars, raise and lower both sides before you can then get the patient mobile in them. These bars are also a bit longer, which gives you a bit more scope in terms of mobilising someone up and down the bars. And as I say, for therapists, they're much easier for us to adjust because it's simply just to push down on your foot and then raise and lower the bar to match your patient. So this is one of our charity-funded pieces of equipment that we can use for all patients who are on bed rest. So it can be used on the intensive care unit right up to the wards. It's a great piece of kit for us because we can have different resistance in terms of leg speed, and we can control that for the patient, so we can be around, up the resistance, lower the resistance. Once they're set up, they've got their emergency stop, so you can actually leave patients on this for sort of half an hour whilst you go and do something else and then come back, because they can stop it themselves. We can then get the feedback of how far they've covered, so in terms of our military patients, it's very nice for them to actually get some feedback. The other useful piece about this piece of equipment is actually you can change the foot pedals that we've got to arm pedals. So if you've got someone who's actually, say, a bilateral amputee, who couldn't obviously go into this in terms of leg resistance, was on the bed rest for grafts or other skin issues around
so
sort of
it's not
healing.
just military patients, it's all patients can essentially use it, so everyone's getting benefit with all this.
This kind of machine, the key benefits to the patient would be that we can get them started on cardiovascular and resisted exercises much sooner. Patients who are previously on bed rest, couldn't mobilise, wouldn't be able to do this kind of thing without this piece of equipment. They can also set some goals for themselves, so they can set resisted time and see how they're progressing, so it gives really good feedback to a patient. And as I say, it starts them progressing in terms of their rehab much sooner than we've been able to do before. In terms of therapists, it's great for us. We can get lots of information from this machine in terms of, again, what level they're at, but also which dominant leg they're using more. So if they've had a single leg injury, we can look at how much they're working that leg versus the other leg on this machine, and it gives us all that feedback.
So this piece of equipment that you can see behind us was funded by the QEHB charity, and we've used it with one of the patients who had soft tissue lower limb injuries as well as bony injury, where their weight-bearing status was adjusted. So what we were able to do is put them on a harness, put them onto the equipment and adjust their weight-bearing status, and then sort of go through their gait pattern and make sure that they're able to achieve that correct gait pattern rather than building up bad habits. So it's very beneficial for those reasons, so weight-bearing adjustments, being able to re-educate gait patterns, and also having hands-on, so you can have someone here hands-on trying to adjust what they can do as well.
Hi, my name's Liz Wright. I'm a principal physiotherapist in the neuro rehabilitation team at Birmingham Children's Hospital. And I'm just demonstrating a piece of equipment that we actually got through charities, which was absolutely fantastic, because this machine actually gives us the opportunity to work with children who have a muscle weakness through one form or reason or other, so either through cancer, spinal cord injury, through general chronic fatigue. And so this is a methodology that we can use to help them start using their muscles again, so that they can get more active, they can maximise their functional ability, and it gives them a really good sense of well-being as well. Some of the children may never be able to walk again, but the sense of being able to move their legs gives them that fantastic sense of well-being and quality of life. For other children who we need to target their muscles, more specifically that we can through manual therapy, we need these extra pieces of equipment and technology to help us with maximising the children's functional ability. So if we can actually buy equipment that isn't available on the NHS, so that we can actually target specific groups of patients that would actually miss out normally, then that's what we're here for. Rehabilitation is such an important part of a child's journey through a hospital. It doesn't doesn't just start and end with the operation. It's about getting them back into their family life, and also start to participate in normal life with children of their own age, their peers and their friends and their family. Here at Birmingham Children's Hospital, we do a great job at rehabilitating children back into their families, their environment and into their school life. We can do so much more. With your donations, we can buy equipment that will facilitate the children to get better quicker. We can use state-of-the-art equipment that currently we're not able to use at the moment. Please help.